In this video, I'm going to tell you the pros and cons of different psychiatric jobs. Now, I primarily work in an outpatient clinic, and some good things about working in an outpatient clinic is that you can choose your own hours, the pay can be better, patients are typically more motivated and willing to seek treatment and get help. They're more likely to follow the directions of the doctor and be receptive to different education. It's also a good opportunity to help people in the community, such as if you're part of a religious or volunteer community and you want to help people for free, you can just have them in your office and do it almost as like a community service or charity. Another good thing about outpatient psychiatry, and can be found in different parts of psychiatry in general, is that you can do televisits. So you don't actually have to be in the office setting, you can work remotely. Also, another good thing about private practice is you can develop these relationships with people over time and you get to know intimate parts of their life. But that could also be a con. A con of outpatient psychiatry is that you know intimate parts of people's lives, and sometimes people have difficult lives and upbringings they've been through. And so as a psychiatrist, you got to kind of learn how to deal with that. Also, outpatient psychiatry can be a little bit isolating. You don't really interact with much other healthcare personnel or other personnel in general. It's primarily just in an office setting and you treat patients one by one throughout the day. Also, hiring assistants like medical assistants or mental health assistants can be a challenge. Also, having them trained properly also can take some time. Most of my 1-star Google reviews actually have been due to difficult encounters that patients have had with office assistants. So while outpatient psychiatry also has a pro of being financially rewarding, can be more lucrative, the con is that you typically need to be there in order to generate income for a private practice. An exception would be if you have mid-level, such as a nurse practitioner or physician assistants. You may not have to always be on site, at least for a nurse practitioner. Or you could also hire other physicians to work for you or with you. So there are other ways to make income in a private practice setting besides being there. Next, I'll talk about consult psychiatry. So some pros about consult psychiatry is you're working in a hospital setting, so there's a team approach. You work with other medical providers, you work with social workers, so you're not the only one involved in a case, and so it's less isolating than, say, outpatient psychiatry. Another pro about consult psychiatry is the pay is typically more consistent. Whether you see a lot of patients or you see few patients in a day, you're going to get paid most likely at the end of the day. Also, you can see some interesting cases and you can see a variety of cases. Sometimes the cons of consult psychiatry is that sometimes you are asked to do things which you are not really expected to do as a psychiatrist. So you got to kind of set your limits or boundaries at times. Some patients also in the hospital setting can take days, weeks, or months to get better. Insurances may not pay for it, and so it can be a challenge or push from an administrative staff or other physicians to discharge the patients, although they're not safe for discharge because they're still sick and they need time to get better. Also, some of the patients that are really sick or confused can actually get agitated, violent, or aggressive, and that can just be emotional toll on both the patients and the staff and the families. And oftentimes they look at the psychiatrist to deal with the situation or handle it, but our choices in psychiatric care are pretty limited, and so it can be a frustrating process for all people involved. With the consult psychiatry, you work in the hospital setting. In the hospital, there always needs to be someone on call or available, even whether it's on weekends, whether it's on holidays, sometimes even during the night. And so whether you're working independently or with a team of other psychiatrists, typically somebody has to be on call, and there can be a conflict with other staff or other doctors if some people want to take off at a certain time and other people have to work, so that can come up. Emergency room psychiatry, there's a huge need for it, there's a huge demand. There can be a lot of interesting psychiatric cases that come involved. It can pay pretty well because it's in such high demand. In fact, many of the emergency rooms, they have a plethora of psychiatric patients that are waiting for psychiatric evaluations or being transferred to a psychiatric hospital, and they really need psychiatric help in those cases to have care for those patients because they want to discharge the patients so that more patients can come into the hospital setting, because that's really a lot of the revenue for the hospital comes from. Another good thing about emergency room psychiatry is often you'll work with other social workers, mental health care support staff. You're working in that team environment. The cons of emergency room psychiatry is that patients there can be very sick. They may be intoxicated on drugs, or they may have like manic or sick illnesses, maybe very psychotic, and they can get violent or aggressive. and so it can be very stressful for all people working in that setting. Problem with emergency room psychiatry also is a lot of patients don't have understanding that they're sick or they don't want to be there, but they do need the treatment, and so there can be a resistance there between the patients and the doctor and the staff in general about what's best for that patient. And sometimes patients need to be just transferred to a psychiatric hospital for their care and treatment, but there may not be a bed available, and so patients can be in the ER for days, sometimes weeks, waiting for transfer to a psychiatric hospital. You work in the hospital setting. In the hospital, there always needs to be someone on call or available, even whether it's on weekends, whether it's on holidays, sometimes even during the night. And so whether you're working independently or with a team of other psychiatrists, typically somebody has to be on call, and there can be a conflict with other staff or other doctors if some people want to take off at a certain time and other people have to work, so that can come up. For inpatient psychiatry, it's one of the most in-demand positions for psychiatrists, therefore you can help negotiate pay and get paid pretty well working as an inpatient psychiatrist. Some of the other good things that the patients there can have interesting cases or conditions. You work often with a team approach with other nurses, maybe social workers or psychologists. There's also group therapy, and so there's a lot of ways that the patients can get better or get treatment. Oftentimes there's just rounds in the morning. In the afternoon, the work is very light, so that's a good thing about inpatient psychiatry. But some of the cons is that oftentimes patients are there against their will. The patients may not think or believe that they need treatment, which can impact negatively the doctor-patient relationship. And so there can be a resistance there with the patients and the doctors or the patients and staff. Also, because the patients are sick, they may get violent. And so that can be emotionally challenging for both the staff and the patients. Also, there's other patients around, and the patients typically have free interaction with one another, which could be a good thing, but on the drawback, patients can be abusive to other patients, and that can lead to a lot of drama or lawsuits or just unnecessary headaches in an inpatient psychiatric unit. Also, unfortunately, a lot of patients that are discharged from an inpatient psychiatric hospital do end up committing suicide, so that can be a challenge that an inpatient psychiatrist will come across. You work in the hospital setting. In the hospital, there always needs to be someone on call or available, even whether it's on weekends, whether it's on holidays, sometimes even during the night. And so whether you're working independently or with a team of other psychiatrists, typically somebody has to be on call, and there can be a conflict with other staff or other doctors if some people want to take off at a certain time and other people have to work, so that can come up. Child and adolescent psychiatry, one of the pros is it's one of the most needed psychiatry specialties. Therefore, child and adolescent psychiatrists can typically command higher pay. Another good thing about child and adolescent psychiatry is you'll learn a lot about child development and how to treat people through the developmental progress and milestones, so that could be interesting. The con is that not everyone will pay higher for a child and adolescent psychiatrist, including the insurances. So just because you can command higher pay doesn't mean people will actually pay you that much. So you might be in a dilemma. Do you use your services to help others? Or a lot of child and adolescent psychiatrists don't actually work in child and adolescent psychiatry because it can also be a challenge dealing with some of the families. Sometimes in order for the children to get better, you have to work on the family dynamics, on the caregivers, on the parents, and they may not be willing to change, so that can be a challenge. A drawback of child and adolescent psychiatry is medications are not often studied in this general population, so a lot of the medications you're using at this time may be off-label, there may be some gray area, so you kind of have to use at your discretion. Addiction psychiatry, the pros about it is that addiction is a big problem in mental health. Drug use can cause a lot of psychiatric problems and even medical conditions, and so those patients really do need a psychiatrist to help manage the medications, help care for them. Oftentimes the addiction psychiatrist will work in conjunction with social workers, psychologists, often in a team approach, because there's inpatient rehabs or outpatient programs that will help facilitate sobriety in the patient. A con about addiction psychiatry is that medications are typically not that effective for most addictions. In fact, the most effective treatment for addictions is typically the community support, such as the 12-step programs such as Alcoholics Anonymous and Narcotics Anonymous. So they may not really need a psychiatrist to be sober. Furthermore, people that use drugs are more likely to commit suicide, so that can be a challenge for addiction psychiatrists. Neuropsychiatry is an interesting field in psychiatry where there's more in-depth knowledge of neurological conditions, and so you get to learn more about that stuff. But the cons is you probably don't need to spend an extra year of training to learn that. Most likely you'll get some exposure during 4 years of a general psychiatry residency. Also, another con is it's going to be hard to be an expert in neurology, as neurology is such a detailed, in-depth field, and there's so many different subspecialties of it, that if a patient comes with a psychiatric and neurological condition, the psychiatrist probably needs to focus on the psychiatric aspect and is going to probably need to refer to a neurologist for the neurological condition. Geriatric psychiatry can be beneficial because elderly patients may respond or may appear a bit differently in their psychiatric presentations. Also, they may have more ongoing medical problems, which is important to consider when choosing medications or deciding how to dose medications. A con of geriatric psychiatry is that it's an extra year of training. Also, there's forensic psychiatry, which can be a very interesting niche for people who are interested in like the court system and legal stuff. Also, you can see very interesting cases of people who have committed horrendous crimes due to mental illness. Also, this sort of field has a specific niche, and it can be really financially rewarding for those forensic psychiatrists that have a good reputation or have created sort of niche that they can help provide their services. A con about it is that it's an extra year of training. A lot of it, you'll have to learn legal jargon along the way. Much of it seems to be taking a detailed history from a patient, and so if you can imagine taking a detailed history from an antisocial patient or someone who's known to be like a sociopath, they may or may not be cooperative. Probably need a cooperative patient in order to get the history. Academic psychiatry can be good in that you can really make a difference in people's lives, like the students or residents or other people that you're helping to train along the way. You also can stay up to date with more accurate medical knowledge through didactics and through teaching sessions. It's not going to be as stressful as dealing with patients that are ill or sick or in a very vulnerable state. The con of academic psychiatry is that it typically does not pay as well as clinical psychiatry. So in short, there are many job opportunities these days for psychiatrists. It pays pretty well. There's a lot of flexibility, and you can see in the variety of different settings a psychiatrist can work in, and there are several pros and cons for different settings. Now, I typically just work as a general psychiatrist, and I currently work in an outpatient setting, consult setting, and in academic psychiatry. There are various other settings that one can also work with.